I've said before, we shouldn't be holding up any of the president's nominees. There's far too much work to be done. But I think that's especially true for the man whose nomination is before us today, the next Secretary of Health and Human Services, Dr. Tom Price, who I'm happy to say has my full support. It's especially important that we confirm Dr. Price because, as we all know, our healthcare system has undergone some serious turmoil as of late. And this was undoubtedly caused, at least in part, by the rolling calamity of Obamacare. You know, you step back and you survey the wreckage, and it's sobering to see what that law has left in its wake. Double-digit premium hikes, very high deductibles, millions of canceled plans. For all the fanfare over the law's passage and all the arguments that followed, it seems we've forgotten the person who matters the most, the patient. That's what the next HHS Secretary is facing, a Herculean, or perhaps you might say a Humpty Dumpty-like task of picking up the pieces and rebuilding our healthcare system from the ground up. So, as we consider this nomination, I think it's appropriate to ask ourselves, if we need someone who will focus on the needs of patients, why not pick a doctor? Dr. Price was an orthopedic surgeon in private practice for nearly 20 years. He taught and trained young doctors personally. So when he hears the phrase quality, affordable, personalized care, it's not an abstract notion to him. It's not something he dreamed up in the halls of Congress, because he himself has provided just that kind of care to real people. When we repeal and replace Obamacare, we have to avoid the kind of thinking that gave rise to it. We need someone with on-the-ground understanding of what it takes to care for patients. Someone who knows what it's like to stand at a bedside with a patient, comforting her in a confusing and frightful moment. Dr. Tom Price is that man. And Tom Price is also my friend. We served together in the House of Representatives. He's a good man. That's why, during his time in public service, he's earned the respect of his colleagues as he's worked his way up the ranks. Chairman of the Republican Study Committee, Chairman of the House Republican Policy Committee, and most recently, Chairman of the House Budget Committee. He's studied our healthcare system from top to bottom, and he's no stranger to the healthcare battles the last 8 years. You could say his chief qualification for the job of replacing Obamacare is he had the good sense to oppose it in the first place. But Tom Price didn't just vote no. Contrary to what you've heard from the Democrats, he also offered his own alternative, the Empowering Patients First Act. You may or may not like that bill, but I think you have to admire that he was willing to make a serious proposal. That's the kind of leadership we need at the Department of Health and Human Services. And so I want to express my support for his nomination to be the next Secretary of Health and Human Services. I urge all senators to vote for his confirmation. I yield the floor.